What is neurulation? Neurulation refers to the folding process in vertebrate embryos, which includes the transformation of the neural plate into the neural tube. The process begins when the notochord induces the formation of the central nervous system by signaling the ectoderm germ layer above notochord to form the thick and flat neural plate. The neural plate folds in upon itself to form the neural tube, which will later differentiate into the spinal cord and the brain, eventually forming the central nervous system. A 28-year-old woman at 20 weeks gestation comes to the office for her first prenatal appointment. An ultrasound is performed, during which the fetus is found to have a congenital defect and no cardiac activity. Due to the pregnancy loss, the patient undergoes an induction of labor. After delivery, gross pathology of the fetus is shown in the exhibit. These findings are most likely due to an impairment in which of the following embryologic processes? The correct answer is D, rostral neuropore closure. The gross pathology of this fetus is consistent with anencephaly, an open neural tube defect. Open neural tube defects are caused by a defect in primary neurulation. This process normally begins with formation of the neural plate, the lateral ends of which elevate to become neural folds during the third week of fetal development. These folds form the neural tube by fusing in the midline, starting in the cervical region and extending rostrally and caudally to the anterior and posterior neuropores, respectively. Failure of either neuropore to close results in an open neural tube defect, and failure of anterior rostral neuropore closure specifically leads to anencephaly, a fatal condition in which the skull and meninges fail to form. The fetal brain is then exposed to amniotic fluid, resulting in degeneration of the developing forebrain, as seen here. Maternal serum alpha-fetoprotein is markedly elevated due to direct leakage from the open neural tube into the amniotic fluid. Prenatal ultrasound shows absence of the brain and skull superior to the orbits. Many fetuses with anencephaly die in utero. Those born with anencephaly may retain spontaneous breathing and brainstem reflexes, for example, suck, moro, but die soon after birth. Choice A, neural crest cells are the progenitors for the peripheral nervous system and several other cell types, for example, melanocytes. Disorders of neural crest cell migration, for example, Hirschsprung disease, involve the peripheral nervous system rather than the central nervous system. Choice B. The notochord is a major regulator of embryonic patterning, and disruption to its development may affect the central nervous system, gastrointestinal, or genitourinary tract. Central nervous system structures related to notochord development include the spinal cord and vertebral column. Defects would not affect the scalp and skull. Choice C. Failure of prosencephalin division leads to holoprosencephaly, in which the brain does not separate normally into two hemispheres. A spectrum of findings may be present, including hypotelorism, a single nostril or proboscis, and/or a single central incisor. Choice E. Failure of vertebral column fusion describes Spina bifida occulta. Gross visual inspection may be unremarkable or show a deep sacral pit, tuft of hair, or overlying hemangioma. Educational objective. Open neural tube defects are a result of defects in primary neurulation, development, and closure of the neural tube. Defective anterior, rostral neuropore closure, for example, anencephaly, results in failure of the skull and meninges to form, allowing exposure of the developing brain to the destructive effects of amniotic fluid.